So we live in an age where most of us have easy access to the internet. You could send a video, some pictures, or even a video call to a vet. So can veterinarians diagnose over the internet? And why do you ever need to take your pet to a vet in the first place? Hi, I'm Dr. Alex from Our Pets Health, helping you and your pet to live a healthier, happier life. So if it's your first time here, consider subscribing to make sure you don't miss out on future videos just like this one, all about helping your pet stay as healthy as possible. So, can vets diagnose over the internet? The short answer is no, and there are several reasons for this. Now, legislation in every country requires that a vet-patient-client relationship needs to be present to diagnose and treat. And really, this relationship needs to build up in person. It can't just be done over the phone. We can't just have a chat, know your pet, and be able to prescribe. And there are a number of reasons why we need to be present. So the first of these is that we need a full and thorough history. And it's simply not practical to do this in a forum or an email situation because it involves a lot of backwards and forwards, clarification, asking and answering lots of questions. It could though be done over the phone or on a video call. So history is not appropriate in some cases, but we're able to get it in other ways with the technology available. So why can't we then just use the phone or a video call? Well, the reason for this is that history is just simply not enough. So symptoms can be interpreted wrong. An example of this would be, say, an animal with colitis, so that's a type of diarrhea. Now they strain with that, and that's then interpreted by many people, quite understandably as constipation, when in fact it's diarrhea. Similarly, in a cat, they might be straining to urinate, and that can be really dangerous. It can be a sign of cystitis and even a blocked bladder in a male cat. But again, that can be interpreted as constipation by an owner. Again, perfectly understandable. So although we really do rely on history, it's critical for vets, and probably much more so than doctors, because we need to know the background of what's going on. Our patients can't talk to us, so we need to put together lots of different clues, lots of little snippets of information to try and form a really big picture of what's going on. And so while that's very important, we also need to tie in that history to what we're finding in clinical exam. And that clinical exam is not something that we can do over the phone or over the internet. That then brings us to why our pictures, you might have a great camera, you might be able to take a photo of the lump or the lesion that you're worried about, or you might have a great video set up and we can do a Skype call or something like that. But why are pictures and videos not good enough? Well, we've got the problem of 2D versus 3D, so pictures are obviously flat, and really we can rely on 3 dimensions to get a full evaluation of what's going on. We also don't have smell over the phone, thankfully maybe in some cases, or touch, so we can't feel, is something soft, is something firm, is it knobbly? And although we could obviously ask you what you think it feels like, if you've not got a really long history, if you're not really experienced of feeling, say for example, different masses, how do you know if something is really spongy or if it's firm? What's the rhythm of their heart? Are there any pulse deficits? Is the heart struggling? We can't tell that over the phone. And we also need some equipment to be able to perform a full exam depending on the case. So we need to look in ears, we might need an ophthalmoscope to look in the eyes, we might want to take a wee skin scrape to have a little look under the microscope to see if there are any parasites or any other concerns. And again, that's not something that can be done remotely. It needs to be done in person at the vet clinic. What we then do is we take all of these pieces. So we take the history, which is incredibly important, but we take the examination findings as well, which is again incredibly important. So no, vets can't diagnose over the internet for a large number of reasons, and really it's not being difficult. We need to get to the bottom of your pet's problem, and that needs to happen in person. If we're just giving backwards and forwards discussion, if you've got real concerns, then that's not going to be good enough, and it's going to delay the appropriate treatment of your pet, which, and that delay can be serious, it can be critical in certain conditions. So online health information, it can only be general in nature, using an average patient as an example. And is there really such thing as an average cat or dog, and how do you know if your pet will fit into that category? So if you want to then know if you can trust the advice given online, how do you trust an internet vet? Well, I've got another video that discusses all of the things you should be looking at to know if what you're reading is appropriate, if there is truth behind it, or if there are things that you maybe want to start questioning. So I hope you found this interesting. Please leave any comments or questions down below. I'd love to read them. But until next time, I'm Dr. Alex from Our Pets Health, because they're family.